Citizen. We're sponsored by the Lancaster County Democrats. My name is Barbara Baier, and I'm today's host and interviewer. Today we have a wonderful guest. Her name is Jennifer Carter. She's from Nebraska Appleseed and is the Healthcare Access Coordinator or Director? Director.
Program, yes.
Well, welcome today.
Thank you. Thanks
and we're going to talk about healthcare reform.
Great.
Tell us a little bit about yourself, Jennifer.
I'm an attorney, and I've been with Appleseed for a little over 6 years. And for those who don't know, Nebraska Appleseed is a nonprofit, nonpartisan legal advocacy organization, and we advocate for low-income Nebraskans, children in foster care, new immigrants, and access to health care. So I came on board a while back and started the child welfare program, and then we had funding to do some health care work around originally small businesses, and we've always done a lot of work around Medicaid rights and making sure the program's running efficiently. And the healthcare issue, even just in the last 6 years, has become more and more important for more low-income and moderate-income working families. That gap between access to public programs and being able to afford private insurance has gotten bigger and bigger. So it's sort of been an amazing transformation in just that time, and so we expanded our healthcare work and feel really fortunate to be as involved as we have been in the national healthcare reform debate.
Now, kind of tell us what kinds of changes you've been seeing. What kinds of challenges are you seeing Nebraska families face?
Well, we have an increasing number of uninsured families in Nebraska, and I believe the latest census data from each year in August, the U.S. Census comes out with data on poverty, and it usually includes healthcare data as well. Nebraska was one of a few states that saw an increase in the number of uninsured. So we have just heard from more and more families, and the data seems to be bearing out that the costs are becoming increasingly unaffordable for families. In Nebraska, premiums have increased 3 times faster than wages. So, I mean, you can see why you wouldn't be able to really keep up, and it's a real struggle for our small businesses, which are the bulk of the businesses in Nebraska. It's the backbone of our economy. And so for a whole host of reasons, I think healthcare reform has become increasingly important, aside from the human toll that it obviously takes when people can't access the care that they need.
Have you ever seen people actually not access health care? I mean, are there times where maybe a child can't get help?
Oh yeah, I mean, we've had clients years ago, and we've heard from other providers that we work with now of clients who ration medicine, look in, you know, try to find old inhalers that they can maybe treat their asthma with. Really some really tragic stories of people who put off care so long that it really, in 1 or 2 cases that we've heard, they ended up passing away. It was beyond the time where they could get the care that they needed. And so, and one thing that's sort of been remarkable, and I say this a lot, is we hear from a lot of people at Nebraska Appleseed. We have an intake line, and for the most part, we are often just doing referrals or trying to, you know, give people some information. We don't usually represent everyone that comes in, but occasionally we have people ask us, well, have you heard this kind of story or that kind of story? And occasionally, you know, depending on what you're talking about, that's not always easy to find. And with healthcare reform, everybody has a story. Everybody is affected by it. Even just, we've been doing a lot of advocacy trainings all around the state, trying to talk to, you know, whoever is interested in the issue. And I'm amazed at how many people who come, they've really been personally touched by it, or at the very least, they know somebody in their family or that's been touched by some kind of struggle and concern around the cost. So.
And I know I'm kind of almost digging here for this, but one of the things when I'm just talking with friends or professional acquaintances is that I often have people say, well, no, you can just go to an emergency room. Could you just share one instance? Because I think people need to realize how much a need is really out there.
Well, there's a whole host of reasons why just leaving it to the emergency room is not a great idea. First, usually by the time somebody comes to an emergency room, they're their health needs are more acute than they would have been had they been able to deal with the cold or the sore throat or the fever or whatever it was before they got to the emergency room. It's not a great place to have primary care. So I go in for whatever my issue is that day, but there's nobody helping coordinate, no doctor who knows my whole situation. And so I might have a test run in the emergency room, and then 2 weeks later in a different emergency room or a different doctor's office, I get that same test run again. It's duplicative. That ends up costing all of us. And if you have really a really acute and catastrophic illness that you cannot pay for, and that's why you're going to the emergency room, again, that ends up in all of our premiums because the hospital needs to make up that difference. They negotiate higher rates with the insurance company. They pass those higher rates on to us. So for all those reasons, an emergency room is just not an efficient or really helpful way to get the care that people need. And we have, this is not actually, the first thing coming to my mind is not an emergency room story, but one that I heard about a federally qualified health center. And this is someone who didn't have access to coverage and waited so long before, and she had some really serious symptoms by the time she finally drove herself. This is in a more rural area to get the help, and my understanding is that she passed away within a week. She had cancer and it was very advanced, and she had never gotten that diagnosed because she wasn't able to go to the doctor. And they kept thinking, well, we don't need it, we can't afford it, and that's a more tragic situation. But there are many reports out there of varying numbers that the lack of insurance really costs people their lives. And I think more than that, in every day, it costs them, you know, possible bankruptcy, medical debt. It just means you're not managing your illnesses and maybe are less productive. You're absent from work. Your kids are not at school or going to school sick and not really learning. For a host of reasons, it's just not the most productive way to have a society where we could have people, I think, contributing more if they were managing their illnesses.